More than 44.7 million COVID-19 cases have been reported in the U.S. since the onset of the crisis more than a year and a half ago. As the country continues to learn more about the virus and ways to contain the spread, some critics say that we're not properly assessing the risks. A new article looks at how Americans can have largely failed to understand COVID-19 statistics. The authors offer insight into how the country can improve the reporting of pandemic-related numbers. Leslie Bienen helped write this piece, and she joins us now. She's a faculty member at OHSU, Portland State School of Public Health. She's also a science writer, and she's also a veterinarian. Thank you so much for joining us. You know, I started this show off with that line about 3 different types of lies, damn lies, and statistics. And as I was going through the article on persuasion, I found myself cringing here and there because, you know, we have been guilty right on this show of throwing out these statistics, some of the very statistics that you kind of put forth as examples, and without context, it's a little misleading. So in your article, you write that it's essential that we use better, more thoughtful COVID-19 math so that we can get an accurate idea of the real risks of COVID-19. Can you explain to us how the numbers can be manipulative?
Yeah, thank you for having me on, first of all. So we went through 4 points that we hope that media and the public could take away from thinking about how to understand COVID risks a little better. And one of the things that we think the media and everyone really could do a much better job with is making age front and center in every discussion about COVID. And if anyone just took one thing away from our piece, it would be that, I would hope that, like, you know, the whole, how do you get to Carnegie Hall, practice idea of just age. And age is the most overwhelming factor when it comes to risk of a bad outcome from COVID. But yet many articles don't really talk about it, or TV pieces. You know, they talk about the average risk, or, you know, your risk for hospitalization, but your doesn't really mean anything when it comes to COVID. And we call that one size fits no one. We just have to stop talking about COVID as if there's an average risk, because there's not.
So Leslie, when it comes to numbers, your article suggests that reporters often fail to integrate and contextualize data. So I have 2 questions for you. The first one is, how should journalists be presenting information? And the second is, how should people receive that information? In other words, it's very easy to even unwittingly mislead or provide a false sense of context to a reader, to a viewer, and there are people who actively do that. We should talk about that people actively use statistics and numbers to mislead and misinform. But how should journalists be thinking about it, and how should viewers and readers think about it?
Yeah, that's a great question. And our second point in the article was try to put numbers in context. And I think when I look at mainstream media, something I really commonly see is that a number has no context around it at all. So for example, reporters might say something like, COVID cases in children are surging, but they don't say what quote unquote surging is. And often it's going from one really small number to another really small number. So, you know, if you have a county where hospitalizations in children are 2 per 100,000 and they go to 4 per 100,000, it's correct to say that they have doubled, but it's kind of meaningless because 4 per 100,000 is still really low. So that's kind of what we're looking for. So instead of saying, you know, doubled or surging or those kinds of words, to talk about what they actually are. And if they're still low, to make that really clear. So when you're talking about numbers off a low base, which is what we have in children almost always, unless, you know, you're in a really unusual situation, like some of the southern counties where they did have, you know, some worrying numbers of pediatric hospitalizations, but that's very, very rare in America. To put those numbers into some kind of context. And then the second part of context is also, you know, to talk about numbers in terms of other risks. So for example, in Oregon, you know, 3 children have died of COVID. it's absolutely terrible if you're the parent of one of those 3 children. But if you compare that number to the number of children that have died in car accidents or drowning or other things that we absolutely accept the risk of, even though we don't want those things to happen, it's much, much, much tinier. So I think both those aspects of context are really important.
So we've been talking a lot about context. I also wonder if part of the problem is where we're getting the statistics from and how they present the statistics. I just remember sort of early on when we were sort of keeping track of COVID deaths, the CDC had like one number that was very different from like Johns Hopkins, where a lot of the media was getting a lot of information from Johns Hopkins. And then I know for me personally, I would always look at our local health department where I live to see what the risk level was. And then I learned later on that, the CDC was waiting for death certificates to come in, so their number was looking different than what the local health department might have. Is that also part of the problem in the way that we've discussed COVID and the numbers, is that we're getting numbers from different sources and they, compile and calculate their numbers based on different factors?
Yeah, I think it is a problem, and particularly on the local level. I mean, because risk is so local, while individual people are looking at the CDC's numbers and maybe those don't match up with other numbers, one of the things we really, really wish would happen is that on the county level, there was accessible data for people. And at least not all, but pretty much all the state and county websites I've looked at are very confusing. And you really have to talk about your own risk in terms of what's happening in your own area. So, looking at CDC numbers is good and useful. It's not going to tell you much about your own risk of where you are. But on a really great piece of news, I saw today on Twitter that the CDC just released data on vaccination and hospitalization status by age. And that's the first time they've done that. And death data, actually. So that's great. I mean, that is so huge for helping people understand what their risk really is. And we said in our article, we would really like it if states would do that, and even counties. But at least on the CDC level, now they started doing it, I think, just today. So I think that will help. But yeah, wow. There's a lot of confusion out there. And just having much more clear tables, a simple breakdown of age risk or of risk related to, your job. I mean, I don't think that data would be too hard to compile, but it's really, really hard to find and very contradictory, as you said, because where it most exists is on the national level. And that's not really relevant for a lot of people. If you live in Mississippi, risk of certain jobs is completely different than if you live in Boston. And I don't know how people can make sense of that without good local data.
It's an important distinction, Leslie. Tip O'Neill, the former Speaker of the House way back in the 1970s and 80s, used to say, all politics is local. And I feel it's the same in a way with journalism. If you're talking about Mississippi, as you just mentioned, the language that is used, if there's a hospital in Mississippi that's being profiled by a reporter or by a newspaper, and the doctor or the chief medical officer says, look, we don't have any beds because we're being overrun by COVID patients, that becomes the headline, right? And it's incumbent on news organizations and the readers, because there's a symbiotic relationship between the news producers and the people who consume the journalism, to understand that COVID is surging in this particular community at this particular hospital may not mean that it's happening across the state or across the country. So how should people be thinking about that? I mean, the example that you use with the car accidents, I've heard that before, but car accidents aren't contagious, and this is a highly contagious disease which has mutated already into another variant, and public health officials say that it could once again mutate.
Yeah, it's true. Car accidents aren't contagious, but if you are vaccinated, you are very, very, very well protected. And while it's, very stressful if hospitals in your area are under stress, it doesn't affect your risk of a breakthrough infection or of a serious outcome from a breakthrough infection. So I think so much of our conversation around COVID nationally and what's come out of the CDC, I'm sad to say, has really undermined people's faith in their vaccines. If you are healthy and under 70, you really don't have much to worry about if you're vaccinated. If you don't have an immune disorder or some reason why you really have to be careful, and those people always existed, they have to calculate their risk differently. But for healthy people who are vaccinated or unvaccinated children who also are very low risk, just the presence of your vaccination is just the most important thing that's going to keep you safe. And, of course, that's why.
So you and your colleagues actually offered up some 4 rules to help identify and prevent common mistakes in reporting. Can you sort of list those off for us? We need some news we can use so we can be better at this.
Yeah. So the first one was one size fits no one, and like I said, emphasize age in everything. In all reporting about COVID, and the CDC's releasing that data is really important, and that's great. The second one was put numbers in context. So like I said, talking about how those risks stack up to other risks. For example, the risk of hospitalization of a child is still really low. It's much lower than other risks we take for granted and accept. And whether or not they're contagious, I think it's important to balance that risk. One thing that I have published several articles sort of getting on the media's case about is just reporting these raw numbers, where not reporting raw numbers, rather. Well, they'll say, pediatric COVID cases have gone up 20%. Well, it's very logical as other people got vaccinated that cases in children are going to make up a higher percentage of cases, but that doesn't mean that something is dire is happening. It's not. It's just that children are the only ones left unvaccinated. So they are going to make up more cases. So, talking about the numbers instead of just saying a percentage, which can be very misleading. And then, like I said, just breaking everything down by age. I mean, that's got to be front and center at all times, because, elderly people, when you start getting over 70, your risk changes a lot. And that's something that, should be emphasized in every single COVID story.
Really good advice. Leslie Bienen, thank you very much. Come back and talk to us again in a few months to see how we're doing and how the rest of the media landscape looks.
Thank you, and thank you for having me.
Yeah, appreciate it.